for those of you who don't know me, my name is Isa. I've been working with plant medicine for about 2 years now for my own personal healing and on a conscious level. And now I'm using my experiences to help people who, the people who generally come to me are first timers with plant medicine. So I help them figure out what their intentions are, what they want from the plant medicine, and then I help connect them to the right medicine for them and where to find it, you know, what kind of ceremony they're looking for. And then I help them integrate afterwards too. Okay. And I'm working with an organization called Awake Healer. And as you can see on the screen, we empower individuals to heal themselves. And I think this is a really important point for me and for us, because a lot of the time people will give away their power and expect, you know, the thing to heal them, like the medicine to heal them, whatever it may be, whatever external source they, you know, will give away their power to. And then it kind of leaves you in this place of victimhood and coming back to the fact that our bodies are magnificent. And I mean, if you think about when you get a cut, you know, who's actually doing the healing? It's not the Band-Aid, it's not the ointment, it's your body healing itself, right? So really stepping into that and realizing that we have all the tools we need. And it's okay to get help from the outside, from, you know, plant medicine. Hi, Kitty. From plant medicine and like whatever else you need to support your journey. But, you know, at the core of it, realizing that we heal ourselves, right? Okay, so that's my spiel. Then let's get right into the combo. So if I'm just assuming you guys are starting from scratch, and yeah, I'm just gonna explain exactly what Kambo is. If you look at the pictures on the right, those are the Amazonian tree frogs where we source the Kambo medicine from. Aren't they cute? Look at the little baby one. So they're only found in the Amazon. They go by different names: monkey frog, the Phylomedusa bicolor is the scientific name for it, giant waxy tree frog, giant leaf frog. So like I said, they're only found in the Amazon, and it can be difficult to obtain the medicine. So someone who, you know, the tribes, the indigenous people from the Amazon are really the only ones who can collect it. So the history of it is, there's a few different stories, you know, circulating about, because it's been around for thousands of years, and obviously just now coming into Western mainstream, just starting to come into Western mainstream. So it's said that the Matsis tribe, which is where it's originally from, they were drinking ayahuasca, and the frog spirit came to them through the ayahuasca, teaching them how to use the medicine in order for them to survive their hostile environment. So they started using the medicine for hunting and healing rituals, and then the warriors would use it to sustain them during hunting trips, and then give them strength, and then they would be really focused, improve their vision. They wouldn't need much food and water when they were on the medicine. And then it's like, some people say it's like you become the frog. So the frog doesn't have any enemies, so they would be disguised, like their odor would be disguised when they're trying to hunt their food, right? So to obtain the medicine, it's a little bit, sometimes it gets controversial with people who hear about how the medicine is obtained, because they'll tie up the frog's legs to 4 stakes and then gently scrape it off their back, because it's a venom actually what they're secreting, and they secrete it when they're stressed. So it's off their back and legs. So they'll gently scrape it off their back and then release the frogs back into the wild. The frogs don't secrete the venom when they're in captivity. So that's really important to know, because then you can only obtain the venom from frogs that are living in the wild. And I mean, if anyone is going to know what is good for the frogs and what's good for the animals in the rainforest, it's going to be these indigenous tribes, because literally their lives depend on it. So I trust them. And there are some people who don't tie up the frogs. You know, they learn how to do the calls, and they'll mimic the frog calls and then call them in and then just hold them in their hand. And then, you know, you have to have a good relationship with the frogs, basically. So this venom can be obtained from both males and females. People say that the female venom is stronger, of course, right? But there aren't any studies or research around whether or not that's true. Okay, so the medicine is administered typically on the shoulders, could be on the arms or the legs. Some people will do it on the chest, but typically it's like on your shoulders, especially if it's your first time. And the first layer, the very top layer of your skin, is burnt, and then the medicine is placed on your epidermis and it enters your body through your lymphatic system. So the medicine has a lot of peptides, just to get into like the science of it, which are chains of amino acids that bind to human cell receptors. These are really good in working in your gastrointestinal tract, blood circulation, adrenal cortex, pituitary gland. So it detoxes a lot of the systems in your body, which is why there's a purge involved, and I'll get to that. But it can contract or relax your muscles, it can dilate your blood vessels, and then, like I said, it's cleansing and purifying. So that stuff has to come out of you, right? All those toxins and everything. So there's usually a purge. Not always, but usually. So here are some benefits. On the physical level, clears up toxins, blocking proper organ function, strengthens your immune system, which is really nice, especially now with all this COVID stuff going on and then coming into flu season. It's an anti-inflammatory, boosts, did I say that already? Yeah, boosts your immune system, can address cancer, infertility, chronic pain, autoimmune and digestive disorders, and your gut is your second brain. So this can regulate a lot of your dopamine and serotonin, can address migraines and Alzheimer's. So keep in mind that the medicine has a different effect on every single individual, right? And it depends on it depends on your intentions, it depends on your own body. And there's a million different factors, and there's not a lot of study that has been done or research that has been done on the medicine, because it is new to the Western society, and they're not doing those studies in the Amazon, right? So it's all very new, but these are you know, firm reports of people who have healed these diseases or, you know, disorders that from a Kambo treatment. On the mental and emotional level, can address depression, anxiety, opens up creativity and focus, mental alertness, can address addiction, cleanses your mind, so it cleanses your body and your mind, and then you can feel, you know, refreshed and strong afterwards. On a spiritual level, you connect to the frog spirit, and then you can purge your body of negative energy or entities. And it's legal. So like most of the plant medicine that I talk about is not yet legal in the United States, but this is a really good introduction if you're new to plant medicine, because it's legal and because it's, you know, it's a short ceremony, it's non-hallucinogenic, and it's just less scary in general and less intimidating. These are some of the effects that can happen during a Kambo treatment: nausea, vomiting, abdominal pain, diarrhea, loss of bladder control, increased heart rate and body temperature, sweating, decrease in blood pressure, difficulty breathing, swallowing. I don't want, like, I know like seeing all of this together is kind of it off-putting, but these are just things, they don't necessarily happen. Like when I did 18 dots over 3 days last week, and I didn't really get any of the physical purge. So it really depends on you as an individual, your intentions, you know, how much healing have you done up until that point, how much you surrender to the medicine. All of that stuff is really important. So just keep that in mind. Don't let this stuff scare you. It's okay. It's only gonna last, you know, under an hour, so you'll survive and you'll be stronger on the other side. So dizziness, blurred vision, disorientation, difficulty breathing, frog face, what they call it, like your lips will swell up, your eyes might swell up, your nose. The area where you receive the medicine might swell up too. Emotional purging, crying, that kind of thing. Loss of consciousness, this happens sometimes especially when you do like 7 or more dots, it's possible. Shakes, seizures, and then at its peak intensity, the symptoms are, you know, around 5 to 40 minutes, and then usually they start dissipating after that. But you can still feel tired for several hours later. So you're gonna want to do it somewhere you can at least rest after, or if possible, have the practitioner come to your house so that you could just sleep after, because I know me personally, I get really sleepy after. Okay, risks and contraindications. If you have any, like, you know, as you saw from the previous slide, there are a lot of effects of the medicine, so you have to be really careful if you have any underlying conditions coming into the treatment. So cardiovascular conditions, epilepsy, Addison's disease, Lyme's disease, Cushing's disease, lower high blood pressure, blood clots, history of stroke, history of aneurysm, sorry. And yeah, like any of these are really, like, I just wouldn't do combo, but always check with your doctor. I'm not even listing all of the things in this presentation because there's just too many. So check with your doctor, let them know that you're interested in a combo treatment, and then, you know, they're the professional. So I'm just giving you like an overview. Any recreational drug use or recent psychedelic use, you have to be really careful around using combo. I would stop, you know, maybe like a week before, but yeah, you could do your own due diligence. And yeah, just mixing medicines in general is just something you should stay away from. If you've had any recent cleansing or detox regimens, because it is like a cleansing medicine, so like you have to have something in you to cleanse, right? Or else it's just gonna draw too much out of your body. Any medications that you're on, antidepressants, NSAIDs, these are just some, like I said, so do your own due diligence. If you are taking medications, you might have to wean off of it, or you might not even be able to do the combo. And then there's always a risk of death. If you've come to any of my other presentations, you know that I always talk about that. But you're at risk of dying right now. So because we're alive, we're at risk of dying, right? But there haven't, you know, like I said, this has been done for thousands and thousands of years, and there's been like 5 deaths reported, you know, since its introduction into the Western world in the past maybe like decade. And most of these people had contraindications like heart disease and seizures. So either their practitioner didn't do enough, you know, research on them, or they lied. I don't know, but these are the things that there are warnings for, right? They didn't just come out of nowhere. And sometimes if you drink too much water, it can cause an imbalance in your soul, because you're supposed to drink a lot of water before a combo treatment. And some people have drank too much water, and then it caused an imbalance in their sodium levels. So those are some of the causes of death around combo. So how to choose a practitioner. This is really important, because just because someone is certified, or just because someone is trained or has been doing combo for years, you still have to vet them, because you want to, first of all, the most important thing is you want to feel safe and you want to feel comfortable with this person who is administering this medicine that is potentially harmful or lethal or can trigger certain, symptoms in you, right? So obviously you want to trust who you're seeing. And so these are just some things to keep in mind. How are they screening you? Are they going through your medical history? Are they asking enough questions? Are they taking your blood pressure, your pulse, your temperature during treatment, things like that? What's the cost? Like, what is your budget? They're around 100 to 150, depends on where you are and what's available to you. But I would say I really wouldn't pay under 100 because I don't know, that just feels a little bit shady to me. What kind of training they went through. And it's okay to ask all these questions, it's your treatment, it's your body. So you should feel empowered about making the decision about choosing a practitioner, right? Where are they sourcing their medicine from? Do they even know where they're sourcing their medicine from? Or are they just ordering it off a shady website on the internet? It's really good because a lot of this work is energetic. So people that are handling the medicine and collecting the medicine, all of that stuff gets stored in the medicine. So you want to know where your medicine is coming from because that's entering your body. And that's in general, like the food you eat and whatever you're consuming, you should know exactly where it's coming from. This is one of my personal factors when I'm choosing someone to work with, humility and reverence. For me, it's not about the practitioner, it's about the medicine, right? So having someone with a big ego who feels like they're the one healing you, I try to stay away from that stuff because to me, it's so important to honor the medicine because it's the one actually doing the healing, right? It's like it's a partnership between you and the medicine. The practitioner is just there to guide and facilitate and hold space. Are they focused on the spiritual healing, or are they just focused on the physical healing? Are they connected to the medicine? Are they connected to the frog? Are they connected to, the Amazon? just some things to think about. And then these are, these are just things for you to ask yourself to see if they're important to you. There isn't like, you don't have to check all these things off the list, but like I said, it's about your comfort and your trust with the person. So you decide what's important to you. Are they taking precautions during administering? Are they, it's an open wound. So are they cleaning the area? Are they washing their hands? But like I said, only if it's important to you. I mean, if you go to the jungle, they're not going to be using alcohol swabs to clean your wound, right? But it doesn't mean that it's not that it's a improper administering. But it just depends. Like for me, I have a medical background, so that stuff is important to me, right? Are they quick to deal with emergency? Like in the risk slide, there's a lot of things that can happen. There's a lot of things that can go, like there are a lot of medical emergencies that can come up. So, do you trust that this person will do the right thing if they needed to? Or do you trust that they'll be able to take care of you if you pass out or have a seizure or whatever the case may be? And like I said, do you trust this person? Do you feel comfortable? Okay, so the ceremony itself, that picture is my arm from last week. That's what it looks like right when you burn it. They burn the top layer and then they scrape off the just the burnt skin, and then it reveals that white layer, which is the epidermis, which is not, it's before you reach the blood. So it's good not to get the blood vessels because you don't really want it going into your bloodstream. You want it to stay in the lymphatic system. So in order to prepare, you should be fasting for at least 8 to 10 hours and then drink between 1.5 to 2 liters of water. Like I said, you can drink too much water, so be very careful about that. And, some different practitioners have different rules and, you know, different ways that they go about their ceremony. So if you trust them, you go by whatever they want you to do or whatever they suggest. And, you know, this is just a general guideline. Setting intentions is really important when you're working with any kind of medicine. And just setting intentions in general, I mean, starting your day and setting intentions can really alter, you know, the way you move through your life. So setting intentions before a Kambo ceremony is really good. And, you know, even if you are coming to the medicine just wanting to heal your physical body, just kind of open up to the possibility of what it could heal or what you would want it to heal if it were to address the emotional, mental, and spiritual levels as well. Because it is working on all 4 levels, even if you're not intending on it to. But yeah, it's good to kind of explore that. And like I said, even if you're only coming into it for the physical, I mean, you're already there, so you might as well get some other healing done too. So you can have an individual session, or there can be like a ceremony kind of situation where there's multiple participants. But if there are multiple people getting Kambo at the same time, you really want to make sure that the provider has enough assistance, because you need to be, I mean, like I said, a lot of things can happen. So somebody needs to be with you for at least, you know, the first 40 minutes, I would say, because you don't know, you might feel like you're through it, but then like you'll get hit with another wave. So you want someone to be there, because sometimes you can't even move and you might need to go to the bathroom or whatever, and you can't walk and you can't see. I mean, you definitely need supervision. So yeah, I would say just to make sure that they have enough assistance if you're going to be participating in a ceremony. Things to think about: your environment should be clean, calm, quiet, you know, preferably fresh air, preferably close to nature, spacious. The provider will probably be using some music and some cleansing tools. And then you want to make sure you're close to a bathroom, because like I said, it can be difficult to walk and difficult to see. So you don't want to have to like go upstairs or anything like that to get to the bathroom. And participate in your ceremony. So if you don't like, you know, if they're blowing cigar smoke in your face and you don't like it, say something. You know, if you don't like the music, say something, because it's your ceremony. So, you know, you should feel, and then you should also feel like the provider is open to your input, right? Usually you're sitting either on the floor or in a chair. You can get dizzy. So people prefer to be on the floor just so they can just lay down. But because of the physical, like it can cause vomiting, you should try to sit up for at least the first 10, 15 minutes or even longer if you can, because you don't want to be throwing up while you're laying down, right? And if you have to lay down, lay on your side so you're not choking on your vomit. And your practitioner should tell this and emphasize this to you during ceremony. So the dots where they place the medicine, sometimes they call them gates, which is, I like that, because it's like portals, right? Determining how many you should get. You know, if you trust your provider again, they should know how many to give you. If you've done, it depends, like if you've never done Kambo before, if you know, depending on your medical history, all that stuff. But usually first timers will start with 2 or 3. And then like I said, the warrior doses are 7 and above. So, I mean, like if you're just going for some cleansing and purging, I mean, I think 5 or 6 is the most that you really need to go. And you're not going that often. So, you know, you're not going to be really building a resistance to it. So 2 or 3 to start, and then like 5 or 6 if you want to go higher, I would say. But again, speak with your practitioner about this, and trust that they know how many to give you too. Okay, application process. So some people will use a dry powder and they'll just put it into the burn sites. And others, the traditional way is using water or saliva to reconstitute, because the medicine is dry on a stick. So they'll reconstitute it with water or saliva and create it into a paste, and then put the paste into the burn sites, the little circular burn sites. So, I mean, if you're okay with the saliva, go for it. But it just seems like a little bit unsanitary to me. And also, you have to really, really, really trust your practitioner, because that's their energy that's going into you. You know what I mean? So, yeah, it just depends on the practitioner, depends on what you want. But these are some of the ways that people can apply it. Oh, okay. I have 10 minutes. Wait. Okay. What to expect? So, like I said, it's like a 5 to 40 minute really intense period. And, it can be really uncomfortable. It can be really unpleasant. Everyone reacts differently. For me, what helps me through any plant medicine ceremony is leaning on gratitude and reminding myself that I'm brave. So that it goes a long way, trust me. And the practitioner is there for you. If you need help, just let them know. And they're there to support you, like I said, which is why that one-on-one is so important. And taking your time, sometimes it could feel like it's done, but obviously you're still not back to normal. So just really taking your time, going slow. And then if you want the dots, usually the practitioners will remove the dots when you're through your process. But there was one girl last week who wanted it off after 5 minutes, and that's fine. If you want it off, then just say, I want to take it off. And I mean, the medicine's already in you, so it doesn't actually matter, but sometimes it gives you that peace of mind that, like, okay, it's off. It'll start to dissipate, and you can calm down and relax. This humility and reverence, like reiterating that, it's so, so, so important, especially with, these ancient medicines that are coming from the Amazon, coming from the rainforest. Like, they're so much older and wiser than us, and we're asking it for help, right? So coming with humility and reverence is so, so important. And it's important for you too, because it means that you're taking your own healing seriously, and it's a way to quiet the ego, And then just some aftercare tips. With the scarring, some practitioners will use dragon's blood to kind of help it scab. You can put some sunscreen, and then if you put lavender oil every day, it helps with the scarring too. But they look cool, so maybe you want it to scar. Stay away from fried and spicy foods. You're getting cleansed, so really just paying attention to your diet afterwards, just to benefit from it as much as you can is a good idea. The purge may continue. I definitely experienced that this week. Could be emotional, could be physical, but just being aware that your body, the medicine is still in you for a couple days after. So your body is still getting rid of toxins, and just allowing it and not, freaking out or anything. It's a good idea. Taking time for yourself. This is just a general rule in your life. Always take time for yourself. After the healing, reflect on things that might have come up during the treatment. And then, taking time, being intentional about what you're consuming, being intentional about what you're exposing yourself to. Because like I said, it's energy work, right? It's energy healing. So even though there are a lot of physical benefits, it's still working on you on an energetic level as well. And you're not off the hook with integration. Even though it's a more physical process, integration is still important. Integration is always important, because that's where the work is. Like I said in the beginning, we are our own healers. So learning to heal yourself through integration, and learning to I guess, take responsibility for your own healing too, and seeing all of these different tools and different medicines as support rather than the solution is just going to help you so much in life, and help you feel more empowered, and help you feel like, you know, this is your life and you're in charge of it, rather than the whole victim mentality that like we're programmed to, the way that we're programmed to think, right? Because of people in control, people in power don't want you to know how powerful you are. So it makes sense, right? And then just a few resources. I'm a certified practitioner so if you're in the New York City area, definitely am offering treatment. So you can reach out to me if you're interested. If you are not in the New York area, there are a lot of awake healer practitioners around the country that I can connect you with. My meetup group is New York Ayahuasca and Plant Medicine. My Facebook group is New York City Plant Medicine Healing. And then Thank You Plant Medicine Healing is a worldwide Facebook group that has a lot of great resources, and it's just a good community to be around. My Instagram at Inspirations by Isa, I put a lot of resources there as well on plant medicine. My email, and if you want to text me through WhatsApp or Signal. And I mean, I talk all day, every day about plant medicine, so I'm happy to answer any questions that you have. And yeah, I mean, thank you so much for coming.